My name is Tom Miller and I am the clinical team leader for the Decisions Unit of Health into Place of Safety. So what for an average person would a mental health emergency department be? It'd be a safe place where people would have the opportunity to go and speak to a registered mental health professional, to maybe have an assessment of the mental health, to review the current circumstances in life and have a holistic view of what's going on for that person. Hopefully then the nurse would have an opportunity to draw up a responsive wraparound plan of care that would support them in improving the mental state and hopefully returning back to their regular life without the need to go into hospital or stay anywhere for a longer period of time. The offer of care is very different from the traditional route of people presenting in the normal emergency department where they'd typically be seen by a psychiatric liaison. As an alternative now, mental health emergency departments allow people to be cared for in a setting that's appropriate for their needs, which are typically less stimulating. They do have registered mental health professionals that have the skills and knowledge to support the person in that period of time. But the real value of them is they're also quite a flexible environment. For example, we've had people who've attended work in between assessments with ourselves and then returned to the service in the evening for further support. So what are some of the key differences between a mental health emergency department and a traditional emergency department? In a mental health emergency department, we have things like a self-service kitchen, which allows the nurses to observe people and informed assessments see if people are managing with certain life skills and make sure that we're making informed decisions and that the outcomes are safe and appropriate for the person's needs. So a mental health emergency department will have designated assessment areas. We have 2 rooms, which are small, low stimulus spaces where people can feel comfortable in engaging in a meaningful way with mental health professionals whilst the service user here. Having the assessment periods means that people are not distracted by the busy, active environments of a traditional emergency department where sometimes people can feel overstimulated or unsafe. The overall aim of the service is to improve somebody's experience, to ensure that people are receiving the right care in the right place, and to support people on being empowered to deal with what challenges they may experience in a real-life environment, rather than the traditional route of being admitted to hospital where some people can sometimes struggle with a busy, stressful setting that acute wards can present. So as a manager of a mental health emergency department, the thing that gives me job satisfaction is the ability to support people at their hour of need and allow them to gain a sense of ownership over the current situation and support them in continuing life, still with the family, able to go to work without the need to go to hospital, and see the real impact and difference that these services have made on people's lives.